Hi, Prescott Valley. My name is Lori Hunt, and I'm your Vice Mayor. Welcome to Council Conversation. And I'm very excited today. I have with me a friend, Deanna Eder. Sorry about that. Director of Marketing and Communication, and Melanie Jacobson, who is the Senior Peer Program Manager, and you're with Polara. Tell me about Polara, Deanna.
Well, Polara Health is a nonprofit organization that's been providing mental health, behavioral health, and crisis intervention in our community for over 56 years. We are the community provider for these services, and we provide services from birth to end of life. So we have about 47 different services. We're growing our organization, which is a wonderful thing for this community. We've seen such a need post-pandemic, and so we're here to talk about one of our services today, which is our Senior Peer Program.
Awesome, and that's where you come in, Melanie.
That's where I come in.
Awesome. So let's start with giving a website and a phone number.
Got it.
Melanie.
The phone number is 928-445-5211, and my extension is 2035.
Perfect. And you can find everything at polarahealth.com.
Great. So, Melanie, you provided me with some information that says nearly 34% of our 122,370 Quad City residents, that's 34% of all the residents in Quad Cities, are 65 years or older.
That's correct.
And that's 41,600 seniors. And of that, 3,328 live in poverty.
That's right.
Which is very, very low income.
It is. It's less than $1,300 a month.
So, and that could even be homelessness.
Yes.
So why is this data important? What do you have to tell me today?
It's vitally important because our area has become a retirement haven. Thousands of people are moving here. And what happens is these folks have left their home, their family, back wherever they came from. They move here and one of the spouses dies and they're isolated and alone. The consequence of that is that they don't know anyone here, and it's very difficult for them, as we all know, to get timely medical care. Many of them can't drive. And as a consequence, they're isolated. So what the Senior Peer Program does is to address that isolation and loneliness in order to reduce the mental health consequences that occur from that isolation. Drug abuse, alcohol abuse. There are statistics that dementia will come on faster. Depression is one of the worst. Yes. And so what the program does is match senior volunteers, 60 years of age and older.
You have to be over 60.
That's most of us.
35%.
And we match them with homebound seniors who need companionship.
So it's house calls by the volunteer.
Well,
or connection calls, really.
Yes. Our volunteers provide companionship. They're not there to do housework or respite care. There are other agencies, nonprofits that do that. What we provide is a friendly face at least once a week. Some of our volunteers meet with their, we call them participants, twice a week, or at least a phone call. We also have a number of support groups for seniors, focused on low vision blind folks. We have a meditation group, men's group, women's group. We hope to start soon, when we get our volunteer base back up, to initiate a low or hard of hearing deaf group One group that is very needed is grief and loss. We have so many seniors here who are dealing with the death of a spouse or a child, or even friends. And a program that we had that was very popular was Singing in the Keys of Life.
Oh, tell me about that.
Music group. Yeah.
Why don't you talk about that?
We had a gentleman that participated. He was a volunteer in our organization, and so he would come in and he'd be prepared with his guitar and music for the day and music sheets for everybody, and he would play and everybody would sing along. And we tried to do it during COVID where we would put him on the camera and people would zoom in. It wasn't as wonderful as being in person, but he was amazing. And so due to the pandemic and kind of changes in our program, or actually changes in his life, that has changed. And so he's not providing our support group any longer. So we're in search of somebody to help.
So you're looking for musicians too. I probably have a volunteer for you, so remind me at the end.
Oh, goody.
Yeah. So
our support groups too are free to the community. So there's something that people come in and participate in, and those groups become very, very close groups that just really rely on each other.
Interestingly, one of our most popular group is our low vision and blind support group, and it has grown under the leadership of Pat Klingman to close to 20 people come. Some of these groups meet once a week, some every other week. But Pat's group is really one of the most popular.
So let's talk about that. Just, I don't know if you know, but we have a transit system now.
Yes.
Called Yavaline, where people can go places for $1.
Wow.
So
that's such a great service.
we need to make sure all of your clients know that, because they just pick up the phone even an hour or two before, preferably the day before, schedule their ride to your group, pay $1, and then we'll come back and pick them up and take them to their door.
Now, our groups all meet in Prescott. Would that still be available to them?
Probably not, because yeah, we're just doing it in Prescott Valley, so maybe you guys need to have some groups in Prescott Valley now.
Exactly.
Yeah.
In fact,
So
most
think
of our
about that.
volunteers are in either most of them are in Prescott Valley. Those that we have left from COVID are in Prescott Valley.
Yeah, so maybe think about that.
That's a good idea.
If you have a facility, because Yavaline will be there for you. Prescott isn't part of Yavaline yet. We're hoping they'll join us eventually, but right now we're just in Prescott Valley.
So fabulous.
Yeah, it is pretty awesome.
Great service.
Okay, so we talked a little bit about the low vision blind meditation group, men's and women's group. Anything else about your groups other than you need to start in Prescott Valley? Melanie, however we can help you, let me know.
We have such a wonderful community partner in Prescott, the United Methodist Church, and they let us use their facilities for free. And so it's worked out. It's such a win-win for us and for our people that participate in the groups. So we'll have to figure something out.
So if that's what you need, let's talk more on that too. So tell me how you train your volunteers, or because we probably have viewers that may be interested in volunteering. Tell me how you train your volunteers.
There's a 4-hour training, and this occurs after we do a screening. Our volunteers are required to be fingerprinted and get a little fingerprint card and a cursory background check. We then probably will be having a training either in early December or the beginning of next year, which is just around the corner.
Right.
It's a 4-hour training. It covers the do's and don'ts. Our volunteers are not psychotherapists. They are not there to diagnose or do therapy. It's companionship, it's friendship. So we're very clear about what the boundaries are, the do's and don'ts.
And resources and
Yes, that is one of the benefits, I think one of the greater benefits of the senior peer program is that the volunteers are able to see what their participant needs and they'll give me a call, and we will set them up with the right agency in order to get those needs met.
That's fabulous.
Yeah, our community is rich in resources,
Oh,
right?
it is
And
very rich.
so we're able to provide some resources to our participants that are in
Right.
our program.
Right.
Yeah, we have some wonderful nonprofits and churches, like you said. So we talked a little bit about that. It looks like you also have resources if the volunteer goes in and says, hey, they might need some house cleaning, or they
Yes.
may need some gardening.
Yes.
Tell me a little
yes.
bit more about that.
Well, we have a close collaboration with People Who Care, who specialize in providing transportation for homebound seniors to doctor's appointments, grocery shopping, that sort of thing. There are a couple of agencies that provide housework, yard work, that sort of thing. People Who Care used to do that, but they're mostly focused on transportation.
And then you've got, Meals on Wheels, right?
Yes.
And in our
Yes,
local one here in
yes.
Prescott Valley. Yeah.
That's fabulous. Okay, so I hear you have some success stories of volunteers with their friendship seniors.
Yes, I
So
will
tell me.
try to summarize this as much as I can. Shelley contacted our program. Her longtime companion had recently died. She just moved here from out of state, did not drive, and was struggling with multiple physical and emotional issues. Shelley was lonely, isolated, and still grieving the loss of her loved one. She reached out to us, desperate to feel better about herself and her life. We matched Shelley up with a wonderful senior peer volunteer, Alice, who made an immediate connection with her. During their weekly visits together, Alice offered Shelley her compassionate, listening presence, and in turn, Shelley came to trust Alice and shared with her openly about her worries, concerns, and needs. Alice provided Shelley with contact numbers to access needed services and encouraged her to connect with these agencies, which she did. Slowly, Alice began to see an improvement in Shelley's outlook on life and a noticeable improvement in her physical and emotional well-being. And that is the core principle of our program. It's just that friendly contact on a regular basis that over time will help the participant come out of their depression, loneliness, isolation, and want to continue back in the world.
Right, and friends are so important at any age.
And connection is so important.
Right.
Absolutely.
And they may need a ramp into their home. And I know right before we started, we talked about the Coalition of Compassion and Justice. And I recently talked to their executive director, and she told me that in the last year or so, the number of seniors 65 or older in their shelter or calling for their services has increased dramatically.
Yes.
And in the last year, they've seen more people 65 years and older than they have in the last 5 years.
Well, what's happened is that with the meteoric rise in rents in our area, seniors on fixed incomes are essentially being kicked out of where they've lived for a long time, and they have nowhere to go because there's no affordable housing available. My understanding is that the low-income housing that's available in our area has 2- and 3-year waiting lists.
And that's something we're working on, and that's a topic for another council
Yes.
conversation
Yes.
because we are, the mayor's appointed an attainable housing workforce, and so we are working diligently on some solutions. So ladies, thank you for being here
Thank
with me
you.
today. Our
Yes.
goal is to generate some volunteers, so
Yes.
hopefully our viewers will be interested in making friends and visits to a local senior in Prescott Valley. Thank you so much for watching Council Conversation. We appreciate you tuning in and have a great day.